We are always concerned about doctors leaving, new opportunities. It's a never-ending position to be in.
That's Mervyn Tweed, the mayor of Killarney Turtle Mountain. He says it's been a challenge to keep physicians in the lakeside community, located roughly 3 hours west of Winnipeg, and it's a challenge that's hurting Manitobans.
We have a really vibrant hospital. We have good people in it, and every community our size and probably smaller is struggling to keep those facilities operating the way they should.
Tweed says there needs to be more resources dedicated to attracting healthcare workers to Manitoba's unique and rural communities like doctors. He says the hospital in his town, the Tri-Lake Health Centre, is staffed up, but he's not sure for how long. Killarney Turtle Mountain is not alone. According to information from Shared Health, at this moment there are more than 55 open physician positions in Manitoba, and elected officials like Mayor Tweed says the government needs to stop talking and take action.
I think we need to refocus the government's priorities, and one of them should be providing health care to rural Manitobans we don't expect the world. We just want good services and a government that shows that it's willing to cooperate with us.
As this year's provincial budget offered no additional funding for doctor recruitment or retention, Mayor Tweed is now taking the issue into his own hands, working with other community leaders on a strategy to get more MDs to Manitoba.
It would appear that it's going to be up to each community to go out and do their own recruiting.
In a statement, NDP health critic Uzoma Askawera claims issues around doctor recruitment in Manitoba run deep. After years of PC healthcare cuts and chaos, including shutting down emergency rooms, it's hard to recruit quality doctors to work in communities that desperately need them. Manitoba needs a strategy to attract and retain talented physicians who can deliver services for families. Shared Health did not accommodate an interview, but said they are actively recruiting for the positions. A statement explained in part, "We acknowledge there are historical staffing challenges, particularly in some rural communities, that have been exacerbated by the wide-ranging effects of the pandemic." The group representing frontline physicians in Manitoba says the high number of vacancies is troubling. Dr. Christian Thompson says Manitoba has some of the lowest rates of doctors per capita, and working conditions could force more out of the field.
Very concerned about the shortages of nurses, technologists, and doctors, and really how these shortages are resulting in longer wait times in our ERs, delays in surgery and diagnostic testing, and what it's doing to our staff in terms of, putting them at higher risk of burnout or exposing them to moral injury.
In Winnipeg, Morgan Modjeski, City News.